Hey guys, it's Miss Hardy recording for Foundations of Health Science on Wednesday, the last day of September 30th. Thank you to everyone who turned their tests in yesterday. Your grades have been uploaded. And if for some reason you had an issue with either your grade and or turning in the assignment, you need to get with me personally and privately. I do plan on posting the correct answers tomorrow, so you have an extra day to get the test done. If for some reason you had an issue, you just have to let me know what you're doing so we're on the same page. So clicking through the daily agenda for today, we will see that we are starting our next unit. It's on the personal characteristics of a healthcare worker. So it's actually like 4 mini units that we're putting into one unit. So I'm going to teach it in parts. So part 1 is going to cover the personal characteristics as far as physical, like physically what should a healthcare professional look like. And then it's also going to cover internally what healthcare providers should look like. Should they be kind? Should they be passionate? Should they be caring? All of those things, okay? So scrolling down to today, we have our discussion post that's due, and that's just asking you 5 qualities that you think a healthcare provider should have, either physically or who they are as a person, and then 5 that you don't think they should have, either physically or, again, qualities that you don't think are good for healthcare providers to be as a person. Then again, we're starting the part 1, so I'm going to do this lecture on Zoom, and then the assignment is posted. Just make sure you're paying attention to these note guides and assignments because I have broken them up for you. So for part 1, we're just focusing on slides 1 through 27. We're not going to do all 27 slides today, but that is the note guide that's due tomorrow. So if you want to get a little bit ahead, you could do all 27 slides in the note guide today, or you can do what we do today, right now, and then you can do the rest tomorrow. Completely up to you, but the note guide isn't due until tomorrow. Okay, so clicking back through this, I'm just going to show you what everything looks like. So obviously we know we go here to find our discussion boards, the modules. Okay, so remember our Zoom one is our longest one. Unit D, personal characteristics of healthcare professionals, and you'll see how I have divided it up for you. So part 1 and part 2. Okay, I'm going to actually unpublish something really quick that looks like a double. So this PowerPoint is what we're going to go through. We're going to do the first part of that. I have to look at it through a different screen so you guys can see it as I'm sharing it. So I'm just going to click to that screen. And here we go. Unit D, personal qualities of a healthcare worker. So when we say healthcare worker, we mean any healthcare professional. There are over 200 different health careers, and there's probably over 300 now, as the healthcare world has exploded in especially 2020 with COVID-19 and the need for more people to provide healthcare and screening. Okay, so there are certain professional standards as healthcare workers we should follow, and it's just kind of pretty much standard across the board, no matter if you're a nurse in an operating room, you're a nurse in the emergency room, you're a nurse that works in a school, you're a dentist at the hospital, you're a dentist that owns your own business, you're a chiropractor, you are a dietitian, you are a physical therapist. No matter what your healthcare field is, there are certain things that we consider professional to be as a healthcare provider. So those are the things we're going to go over. And it's really important to note, guys, that first impressions make lasting impressions. So the first impression you make with either your patient, your coworkers, your boss, your peers, those are typically made within the first 20 seconds that someone meets you. It can take up to 4 minutes because it may be that you're introducing yourselves and getting to know one another, but typically it happens by 4 minutes. You have your first impression of someone. And we want to make sure that we always give off a positive first impression. Best advice I ever got was as a junior in high school, I started pursuing health careers, and I applied for a VITA internship. And the lady who was in charge of it said, I see kids all the time who go out to the grocery store, and even adults who go out into the grocery store, and they have like SpongeBob SquarePants on and their hair thrown up in a bun and a hoodie, you know, that has something inappropriate on it. And you just never know when you're going to meet your next boss. You never know when you're going to meet the love of your life. You never know when your patients are going to see you outside of your workplace. And you want to make sure that you always give a good first impression, and you make that first impression who you are when they see you, when they work with you. So keep that in mind. I always think that's really good advice to have. Always be the best that you can be, especially when you have people watching. So here we are going to talk about how to create a positive first impression by being well-groomed and having a natural appearance. So as healthcare providers, we obviously promote good health. Um, so promoting good health means that you are what you promote sometimes. So I, of course, want to be, someone who not only promotes good health, but practices that myself. So in order to practice good health, we are going to encourage our patients and ourselves to do a couple of things. First and foremost is following the food guide pyramid. We want to have a well-balanced diet. We want to make sure that we maintain a healthy weight, because that makes us feel better. When you eat well and you rest well and you maintain a healthy weight and you exercise and all of those good things, you feel better. And the better you feel, the better you can treat your patients. And of course, promoting and improving mental alertness. As healthcare providers, we can make a mistake that costs our patient their lives. So we have to be very mindful in, if we choose to make poor decisions outside of work or inside of work, what it could mean for our patients. So scrolling through, we talk about rest. It provides energy and the ability for us to deal with the daily stresses of life. So as students, a lot of you guys will like stay up all night working and then you sleep until lunchtime the next day. That's not really getting adequate rest. That's not the way our bodies are made. Our bodies have what we call a circadian rhythm. And that also goes along with like sleeping at night versus sleeping the day away. We want to be productive. So if you're not only getting 2 to 3 hours of rest at night, you're not getting enough to really be as healthy as you can be to treat your patients. Okay. So again, don't try to pull any all-nighters. Those aren't very healthy for you. Take time, study when you need to, get up early if you need to, but make sure you're resting. Same thing with healthcare, okay? Exercise maintains circulation, it improves muscle tone, and it can, of course, help your attitude and promoting restful sleep. So exercising, whether it be walking, dancing, sports, running, biking, whatever you choose to do as an exercise routine, truly contributes to making you a better version of yourself. So we encourage our patients to do that, so we should do that as well. Avoiding alcohol, tobacco, and drugs. Now keep in mind, you are not allowed to consume alcohol, smoke tobacco, or use drugs as healthcare providers on the job, obviously. And we would, as healthcare providers, encourage our patients not to use those things, because they can be unhealthy habits. Of course, illegal drugs, illicit drugs are not allowed, period. Most healthcare facilities are tobacco-free, which means you cannot smoke or use tobacco of any kind, including vapes and juuls, on the campus. So if you ride by Vidant, you'll see people standing outside smoking. That's because they cannot do it on Vidant property. And then, of course, avoiding alcohol. Now, none of you are old enough to drink yet, but when you reach that age where you are, we discourage, as healthcare providers, drinking the night before you work, because you, again, are holding someone's life in your hands sometimes. And it's really important to note that if you are not the best version of yourself, if you're not feeling well because of what you did the night before, or you were to even walk into a patient's room and have a smell of alcohol on your breath, you're not safe to treat that patient. And of course, I wouldn't want to be the reason that something went wrong with my patient. Moving on to posture. Posture prevents fatigue and muscle stress. So normally in class, at this point, I have everybody freeze and we look at everyone's posture, and then we stand up and we talk about good posture. But not only is posture good for your body, because bad posture can cause you pain and discomfort, but posture says that I'm ready to take on my day, okay? So if I lecture to you guys like this every day, it doesn't really look like I'm very interested in what I'm doing, right? But I lecture to you with my shoulders back, I'm open, I am using my hands, but you can tell that I'm alert and I'm interested in what you have to say. Bad posture can send the bad signals, okay? So a couple of tips and tricks here would be standing or sitting with your shoulders straight, tummy muscles in, weight balance on each foot. So for me, just sitting here facing straight forward to you guys as I'm lecturing to those in class, and then those on the Zoom. Females should sit with their ankles crossed, especially when wearing a dress or skirt. Most healthcare professionals don't unless they work in more of an office style setting, wear a dress or a skirt, but it is discouraged to cross your legs. Um, and of course, if you are going to wear a skirt or something like that, we just want to maintain our modesty and make sure that we are sitting appropriately. Okay. So moving on to your physical appearance. This is the first thing people know about you. This is the first thing people see about you. Okay. So first and foremost is your uniform. Okay. And I want to make sure you guys are listening during the Zoom versus like filling out your notes. You're going to have plenty of time to fill out your notes. So just make sure you're kind of listening to me because you'll remember me talking when it's time to take your test. Okay. So your uniform. Most people in the medical world, when we think about doctors and nurses and chiropractors and all that, we think about scrubs. And that's what you see this gentleman wearing here. Okay. So first and foremost, if you, and I know this is on your test, if you get hired for a new job, okay, and you want to go find uniforms, the first thing you need to look at is the uniform policy. What does this facility require me to wear? Because I don't want to order scrubs that are in the wrong color. Or if I'm not supposed to wear scrubs and I'm supposed to wear khakis, okay? I did work in a physical therapy clinic one time where we were not allowed to wear scrubs. We had to wear khakis and professional dress and white coats every day. So it just depends on where you work. At Vidant, I wear Navy scrubs, okay? So I had to make sure that I bought Navy scrubs. But you always want to check the uniform policy. You want to make sure that it's clean. You don't wear repeat scrubs. Think about all those germs you pick up in the hospital with all those sick people, or even in your clinic. You wouldn't rewear the same pair of underwear the next day, okay? So making sure that it's clean and it's neat. If you have a pair of scrubs that are your favorite scrubs, but they're pretty stained up, might be time to retire them, okay? You want to make sure that it fits well. If it's too tight or too large, it's going to give you a poor fit, and that can hinder your job. If you wear a pair of pants that are too tight and you have to perform 45 minutes of CPR on a patient, you may be limited because of the clothing that you have on. So just keep that in mind when you're purchasing your scrubs as well. And again, the uniform must be appropriate for the job. And of course, the reminder here again, check the uniform policy. Moving on is your name badge. You'll see here, this name badge. We wear name badges here on campus at North Pitt. The name badge, first and foremost, identifies who you are. Think about if you've ever been in the hospital or you've ever had a family member in the hospital, how many people came in and out of that room to talk to you. You either are never going to remember their name, never going to remember their face, but you always can look at their name badge to find out who they are. So just like this name badge has here, it has her name, it has her title, so she's a nursing assistant student, and then it has when her ID expires. So a couple of things. We are moving away from using last names on name badges, and I can tell you from personal experience, you would not add your patients or their family members on Facebook or Twitter or Instagram or anything like that because that wouldn't be considered very professional. But if they have access to your last name, they could certainly go and look at your social media accounts. So my little plug here is I wouldn't post anything on social media that you wouldn't want your next boss or your next patient to see. And as you guys are so young and you're still, learning these things, it's a great time to learn that anything you put on the internet can come back to you, okay? So make sure if you're posting on Instagram, Facebook, Twitter, Snapchat, all those things, it's something that you wouldn't mind your next boss seeing, okay? Moving forward is your shoes. So of course we think about closed-toed shoes, tennis shoes, things like that are very comfortable. If you're going to be standing all day, you want something that's going to be comfortable for you to be literally on your feet 12 hours a day. I know even me, when I have a long 8-hour day at school and I don't have the right shoes on, it feels like it's 16 hours. One thing I do mention here, both of the shoes that you see on this PowerPoint are completely appropriate. These are very much so what we like to call those nursing shoes, and then you have your traditional tennis shoe here. One shoe that everybody loves and they think is so cool to wear with your scrubs is Crocs. Well, Crocs are not safe. Crocs do not have a hard sole bottom, so something can actually poke through the Croc and go into your foot, and they do have holes on top. So if you're in a room with a patient who has C. difficile, which is a contagious bacteria that is present in feces, and your patient has a bowel movement, you could potentially be spreading that at home. And you could, if your patient even has a urinary accident where they pee when you're working with them, Crocs, guys, are going to allow all that to seep down into your feet and your socks. So Crocs are not cool for medical providers. Personal hygiene, of course, daily baths, okay? We're not going to get all the germs that we get every day working as a healthcare provider. You know, Miss Johnson sneezed on me, and then I worked with a baby that spit up on me, and then, you know, even with COVID-19, before that even existed, it was never a good idea to rewear your scrubs, and it's always a good idea to shower. I always shower as soon as I get home after treating patients, just because I don't want to take those germs into my house. I don't wear my shoes in my house when I treat patients, especially during COVID-19, because sometimes I sit on the floor and my baby crawls around on the floor. So that's something you don't think of. But if you're tracking all those germs in your house, you definitely need to take a shower every day. Using deodorant, because we work hard as healthcare providers, we're going to sweat some, okay? Brushing our teeth, okay? Even though we're all wearing masks right now and for the foreseeable future, my coffee's pretty strong. And when I work with my patients, I don't want them to be overwhelmed by the smell of my coffee breath. And avoiding strong odors. So a lot of the times people think odors is like the bad odors. Like if you are not smelling your freshest one day, or you smell like cigarette smoke. I personally don't want to work with a healthcare provider that smells like cigarette smoke. That's a smell that's going to give me a headache, and it's going to give me a bad impression. Okay? But strong odors are not necessarily all bad ones. So all of you who like to bathe yourself in Bath and Body Works Coconut Paradise or Old Spice, whatever, those are odors as well. And so we do not do that as healthcare providers, because we are, when we come into work every day, we have a servant's heart, which means we serve our patients and we take care of our patients. We're not there to have a beauty contest. So no, you shouldn't come in with your hair done and a full face of glam and all of these things. But you also do not want to make your patients uncomfortable because of a choice you've made as far as your hygiene goes, body sprays, whatever. And in talking about that, your nails is another thing. So I see so many girls now in high school who have those super long nails. And when they learn that you can't have those in the medical field, they're like, oh, I'm going to pick a new field. Well, to be honest with you, having false nails is actually kind of gross, okay? So think about it. Have you ever had dirt under your fingernails? I have. If I'm like outside playing softball, playing with the dog and I scratch them, I'll get dirt under my fingernails. Having false nails just basically traps all that dirt and gross stuff in between your nail and the false nail. So if you have acrylic nails, gel nails, all that, you're just trapping bacteria under those nails. So as healthcare providers, do you think we sometimes have to help people who have gone to the bathroom on themselves? Absolutely, okay? You constantly, right? Even as a physical therapist assistant, people are like, well, it's not your job to help people go to the bathroom. Well, if my patient has to go to the bathroom and they've got to walk to get there, then yeah, it is my job, okay? And so I've had to help clean patients up a lot in the past. And I wouldn't want to accidentally rip my glove open while I'm wiping someone's bottom end because of a fake nail. Not only is it a risk of hurting them, but it's gross and bacteria grows there. So you are allowed to have false nails in the medical setting. The example here also says that if polish is permitted in your healthcare environment, you should avoid bright or dark colors. So for example, in surgery, they don't allow polish because that polish could chip when you're in the middle of someone's body. And so it says bright or dark colors. That's actually not as stiffly enforced as it used to be. So you can have, if you want to wear red polish, that's okay. What you would not want to do is wear red, blue, green, purple, yellow, okay? Because that's not really a way to portray a professional appearance, okay? Your hair, so if you have really long hair, it needs to be pinned back. You don't want your hair in your patient's face. You wouldn't want your hair to get caught into anything. I've had a technician who worked with me before who got her really long, beautiful hair caught in a screw on a walker when she bent down, and it was really uncomfortable for her, and it's just not professional. A lot of the nursing programs require you to pull your hair back and put it up so that it's out of the way. And again, you wouldn't want your patient having to like taste your hair when they're working with you. And I have had patients who've tried to pull my hair before. So if I have my hair even down the way it is right now, even though it's out of my face, it's still at a point where a patient could grab onto it if they needed to. And of course, that depends on where you're working. You know, are you working in an environment where someone may want to pull your hair? Think about a child, or maybe someone who is in a rehabilitation facility and is detoxing from certain illicit drug use, whatever that might be. So just keep that in mind. You'll have to pull your hair back. And last but not least is jewelry and makeup. So minimal jewelry is best, okay? If you notice, I don't wear my rings to school, my wedding rings to school, because I don't want to track any germs home. When I wear my wedding rings, it's typically outside of school or work, because I don't want those germs. My daughter holds my hand. I don't want those germs on my rings. But also because it can catch on your glove, it can be very uncomfortable. One thing I like to tell people is when I go to the dentist, and I think it's so cool that my dentist has this huge rock on her hand, but I can feel it when she's in my mouth and she's moving things around. So that's just an idea of why you wouldn't want to do that. You can wear one ring per hand. So if you wanted to wear a wedding band, and then if you had another ring on this hand, that's fine. One ring per hand. As far as makeup, it should look natural. So you shouldn't look like you're about to go walk the runway for the Paris fashion show. Okay, because that is just not portraying a professional appearance. And again, it's okay to feel good and look good and feel good about the way you're presenting yourself to your patient. However, we are not there to be Tyra Banks. We are there to serve our patients and anything that they may need. And we're never too pretty. Our hair is never done too well to help our patients, okay? Let's see. I think that's the last thing as far as your physical characteristics, as far as what you should look like, and the professional behaviors like good posture that you should have. One thing that's not mentioned in the slideshow that I do like to mention is obviously we are at a time where tattoos are more accepted. And even at Vidant now, you can have tattoos that are shown as long as they are appropriate. My advice to you would be for interviews, you may choose to cover up those tattoos because you don't want anyone to judge you. You may want to consider putting tattoos in places that can be hidden, such as past the length of your sleeve, okay? So past the length of my sleeve, or somewhere where you could cover it in the event your facility did not allow for tattoos to be shown. So thinking about putting them on the neck, on the hands, things like that, chest, maybe somewhere you would want to reconsider. Obviously, more places are being more accepting of tattoos and things like that, but it's always something to think of as you progress through. And even in the military, I think they have certain rules and regulations as far as where tattoos can go. So just keep that in mind. So for now, what you're going to do is pull up Unit D, Part 1. You'll see that it's due tomorrow. When you click on this, it's going to pull it up and you're going to download it. Okay, so I clicked on it, but you won't be able to see it. It's basically like a guided notes flow chart for you, and it walks you through just like the PowerPoint is. We only got through part of the slide, so we did not go all the way through 27. Okay, so you guys can, if you want to, go ahead and finish your note guide. That's fine with me. If you choose not to, we're going to lecture on the remaining portion tomorrow. That's probably the most important portion, learning those terms like empathy, dependability, responsibility. So that will be what our lecture is on tomorrow. And then we'll make sure we all have a good understanding of this information before we move on to the next part, which is part 2. So if at this time nobody has any questions, I will stop recording the Zoom.